Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today on Lyme Time, I welcome Katarina Podaras, who is the founder of New York BioMagnetic Therapy 369. And I don't know a lot about biomagnetic pairing therapy, but I'm excited to learn how that can get to the root cause of symptoms and reverse them and begin reversing the process. And it's just such an exciting field for me to learn more about. And I know that you will enjoy this episode so much, and I'm just thrilled to have you here. Welcome, Katarina. And tell me how you got into biomagnetics.
Of course. Thank you so much for having me. So I got into it because I had my own problem, which was melasma. It was a skin issue and it's hormonal. And what it does is it creates big brown patches on your skin and mostly on your face. So when I got this, I had no idea what it was and where it came from. So I went to a dermatologist and I said, I have this problem. I can't live like this because I want clear skin. I have to cover it up all the time with very thick makeup. And I wasn't used to doing that. I was used to just, wake up in the morning and just go to work, not really doing a whole face of makeup routine. So the doctor said, there's nothing we can really do about it. Just stay away from the sun, and that's it. So I had no solution. I was really sad. I didn't know what to do. I started not wanting to go out. It sounds too much, but it really affects you when you
Oh,
have,
sure.
on your skin, on your face, blotches of dark patches. And so I said, okay, let me do some research. And I found this spa, this lady, and I went to her and she said, look, I can put this cream on you and you're going to come twice. It costs $1,000, but it's going to come back because this is hormonal. It's from inside your body. Okay. And I said, okay, but I love the fact that it will come off, but what happens after? And she said, well, I have this lady that does this therapy. It's called biomagnetic therapy, and she can regulate your hormones so that the melasma can go away and heal from the inside, from the root. I'm like, wow, that sounds amazing. Sign me up, you know? If
Absolutely.
if this can heal me and it can go to the root of the cause, yes, I want to do it. And so I went to the lady. I did 6 therapies because it's a deeper issue when it's hormonal.
Mhm.
And she explained everything to me. And then after my third, fourth therapy, my melasma started to disappear. And I was amazed. I could not believe it. Because mind you, I had done all this research before. How can I get rid of this? And there was nobody except from that cream that cost $1,000, and it didn't, it was going to come back, nothing else. So then I said, I'm already into health and medicine because I was a medical assistant. I'm already into health, so why don't I learn how to do this?
Yeah, absolutely. Let me learn how to do it, give somebody else the tools to actually getting to the root of the problem. And by the way, melasma is a very common, I think
Skin
almost
issue.
every one of my friends has it at some point in their lives.
Exactly.
And so understanding that everything has a root issue. And
Absolutely.
so now we're going to talk about how exactly
Yes.
the biomagnetic
Magnetic.
pairing
Mm.
actually works. I mean, how would that actually work with hormones, Lyme
Yeah,
disease, that kind of thing?
right.
So
So
the mechanics of it, if you
yeah.
will.
So, biomagnetic pair therapy means that you use medical grade magnets, which means that the magnet has the strength, right, to
Yeah.
change the pH to its neutral. So, you take a negative magnet and you scan the body. You scan 200 to 300 points in the body, right? And when there is a when you put the negative magnet, let's say on your liver, okay, and let's say there's a distortion in the pH of your liver, right? Let's say your liver is not in the correct pH that it should be for the liver. That creates a muscle contraction.
Mm.
When I put the negative magnet on the liver and there's a distortion there, there will be a muscle contraction, and one foot will temporarily become shorter than the other, which is a muscle contraction, and you can see it. And so, therefore, you know, okay, here I need to also put a positive magnet with the negative together, and that will bring it back to its original pH. The liver will go back to its original balanced state.
It's so the magnets will help regulate the acidity that's going on. Is
Or the alkalinity, because it's not common knowledge, but even alkalinity does not mean health,
Hmm.
right? Neutral means health. Homeostasis means that you are in a neutral pH balance.
Yeah. With
So,
with all these alkaline waters and things like that, you would think that, oh, that's what I need for perfect health. But you're
right,
saying you
that's
just
not
need
the
balance.
case. No, that's not the case. Actually, in acidic environments, viruses and funguses thrive in
Mm.
acidic, and in alkaline, bacteria and parasite thrive.
No, oh my gosh.
Yeah,
So of course this is the key for Lyme, the people with Lyme disease. Now,
exactly.
many with Lyme disease also have a history of, I'm one of them, with acquiring different viruses over time. So I'm never really sure, at least in the beginning of Lyme disease, I was like, is this the EBV coming back again, or is this an actual symptom of Lyme disease that would be a bacterial? So I
Right.
imagine if came into your office and I was in an acute state of Lyme disease,
Yes.
which is extremely painful and confusing and everything else, you
Absolutely.
might, then how would you decide what
So
to tackle first?
this is what happens. So you come into my office and we do a full scan. We do a therapy, right? And with the magnet, I find every distortion, every co-infection, every virus, every bacteria that is causing you to have these symptoms, these Lyme symptoms. Now, other people, every Lyme's patient is different because other people have muscle aches and pains,
Mhm.
mostly. Some people with Lyme have insomnia. Some
Mhm.
people have depression. Some people have brain fog and tinnitus. It depends where what their co-infections are and what bacteria and viruses are affecting them. But with this therapy, you find each one, you neutralize it, and then the healing begins for the person.
How many sessions do you typically see with somebody with
So it's
normal a case of Lyme disease? I can't even say normal, but your typical.
the typical. Okay, so it really depends on how many years the person has Lyme. Okay, so it's different if you've had it 20 years because it's more established in your body, harder to find those imbalances, right? Now, the longer you have it, the harder it is. Like if you have it for 1, 2, 3 years, it's a lot easier. Now, usually I'm going to say if you've had it under 5 years, it's going to be 3 to 5 therapies, maybe 6. If you've had it more than 10 years, it's going to need at least 10 therapies, at least.
And describe to us what it looks like. I mean, when we come into the room and we're getting a treatment from you, are we lying on a table? Are we hooked up to machines? What does it look like?
Okay, so no machines whatsoever. You just lie on the table, the massage table, with your back face up. You relax, and I start scanning with the magnet. I look at your feet because remember, I have to find the imbalance. I can't see in your body, so I'm looking for that muscle contraction.
Mm-hmm.
And when I find the muscle contraction, everywhere I find it, I put the 2 magnets. I put the 2 magnets. And when we're finished doing that, the scanning, then you stay with the magnets for 20 minutes so that it can balance the area.
Mm-hmm.
Most people fall asleep because it's so extremely relaxing, because the magnet puts you in a different state. Like, I think it's the beta or alpha state. When we watch TV and we're kind of like relaxing, you're kind of in that state. Most people, not everybody. And that happens so that the body can start to heal. So it's very relaxing. You don't have to do anything. You're with your clothes, right? Because some people they think they have to undress, but no. And that's the therapy. I find the imbalance. I find the bacterias, co-infections, Bartonella, Borrelia, whatever the case may be. And from what I find, also, I can tell you how many therapies you're probably gonna need.
Mm-hmm.
Right. And now after the therapy, you're gonna probably go through a little Herx reaction, because when the body heals naturally, it will need to heal in a way of like, headache, a loose stool, things like that. So it's excreting the toxin,
Mm-hmm.
basically. Yeah.
And what kind of protocols do you suggest that they go home and do at home after treatment?
Yeah. So after the treatment, it's best to go home and relax that day. Um, take a shower before bed, lay in clean sheets, clean everything clean, PJs, whatever you wear. Change your toothbrush, because our bacteria is on our toothbrush. So we don't want to reinfect by using the same, because we're trying to excrete it, detox it out of the body. A new razor if you shave your legs, or your beard if you're a man. That's it, basically.
Hmm.
The next day, you might go through a Herx, you might not. If you do, take it easy. I mean, it's not like the worst thing. Um, it comes, and it's light for people. They get over it and they're like, okay, yeah, I didn't feel great, but it went away. It goes away fast. But then they start to feel much, much better. Like, like the pains, like let's say somebody has muscle pains and aches, they feel much better, even from the first therapy. Most people.
And how is this different than magnetic therapy or magnet therapy?
Right.
Because these are two different therapies that are offered to Lyme disease patients.
Yeah, well, magnet therapy, they only use the negative pole. They don't pair the magnets. So they don't work with the pH balancing, because you can't balance with just one pole. You need both. So I've never done magnet therapy. I just know about it, and I know that it's different from what I do.
Sure.
Yeah.
Wonderful.
Because basically when you use the 2 magnets, that's what depolarizes the bacterias and the parasites, all that. Because according to this therapy, only in a pathogenic environment can bacterias, viruses, parasites, and funguses live. Once you neutralize that environment, they can no longer live there. There's no way they can thrive in a neutral environment. So basically, you're changing the environment.
Hmm. Well, we are
Understand?
energetic beings, right? And
We're
we are
electrical.
we are electrical. So I would imagine that would be a very strong indicator when you're putting magnets over certain parts of the body. Now, is there a difference if you're feeling something in the liver versus something up towards the brain or the heart or something like that in terms of your treatments, or is it just pairing the mag?
It's just, for me, I have to find where your imbalances are, right? If that means, because like the EBV, it's in the brain. For the magnets, the placement is it's in the back of the brain. So yeah, if you have EBV active, it's going to depolarize it. It's going to inactivate it.
Hmm.
So it depends.
It's so fascinating, actually, to me. It's just so fascinating. But yet, I think this is when this falls into the category where people come to you probably after they've tried everything else.
You're so smart.
And
Yes, it's true.
we're told, oh, get the antibiotics. We're
Yeah,
told, and of course, if you can catch it right in that window,
absolutely.
wonderful. I always tell people to try, allopathic.
Yes. But you know
Me.
what? People don't know that there's a small window for you to take that antibiotic. If it's been more than 72 hours, I really don't think that that antibiotic can help. And if it can, more power to you, take it. You know what I mean? But we're talking about people that have had it for years. And the problem with Lyme disease is that people go to their doctor, they say, look, I don't feel good. I don't feel good. And they do all these tests. Oh, you're fine. You're stressed. You're this, you're that. And they have Lyme disease, and it's not diagnosed properly. And I don't know why that happens.
Well, it has to do with it can present in so many different ways. There's 20 different strains of Borrelia, I think, in and of itself. And it will do something different with each patient. So, for instance, my first symptom was the fact that I couldn't walk. I couldn't bend my feet the way I wanted to and I used to, and I couldn't tie my shoes because there was so much nerve pain there. But I thought it was a foot problem. So I wasted a lot of time going there. And, I mean, the list goes on and on. Now, thankfully, 15 years later, there's so much more education and awareness. And I think that we as a whole are very happy to go to that infectious disease doctor or a neurologist and all of that. But I think as a whole, especially since COVID, we're opening our horizons a little bit, and I try to encourage everyone to welcome different forms of alternative medicine because you will never get there by just trying to kill the bug in and of itself. I mean,
Absolutely.
if you do, it's rare. And with children now being born with Lyme disease in their blood and in their systems, it's just so important to have some safe, very non-invasive therapies in your toolbox so
Absolutely.
that you can treat yourself without having to, number one, pays thousands of dollars to get put into a chamber to do whatever, but also to really give yourself some kind and positive therapy.
Yeah,
I was first. I've used magnetic therapy before, and it's pretty incredible in terms of how quickly it can work.
very well. Very.
Actually, I know people out there may not be really hip to this or subscribe to alternative methods, but let me tell you something. It does work.
It does work. I understand these people because we are taught from a very young age that when we're sick, we go to the doctor and the doctor gives us medicine. And that's it. That's what we know. But apart from that, there are other methods to help your body. There really are. And this coming from a person, I used to work in a hospital. Like, I'm not opposed to that either. But especially with Lyme's disease, there's nothing that really can be done from an allopathic point of view. And most of the people I get, like you said, not for just Lyme's, but for many different illnesses, they come to me and they're like, look, I've been to every doctor. I've done this, I've done that. It doesn't, please help me.
Mhm.
Most of the people I get are like that,
Yeah,
Um,
and of course, um, different things that I've done along the way. For instance, I went on a juice cleanse one time. I've always cleansed and done juice cleanses
nutrition is very important.
but it was messing with as I got Lyme disease, it started messing with my alkaline levels. And I don't know what was happening, but I would start getting these heart palpitations.
Wow.
And as soon as I laid down, and I was thinking it was a heart issue and da da da. And I went and got all these tests and everything, and everything was perfectly fine. But I realized that it was because I was so off balance and my electrical system was just thrown off. So,
Wow.
magnetic therapy pairing might have really helped me in terms of that.
Absolutely. I mean, like I said, it helps with all types of Lyme symptoms. I mean, it helps with any type of disease, but because we're talking about Lyme, it helps a lot. Any Lyme patient I've had, after 2, 3 therapies, they feel like a different person. They
That's
really do.
great. That's
Yeah.
great. And in terms of symptom control, I think it's wonderful. And if it does anything beyond that, like neutralize the environment for which these things just multiply and dig in and everything else we have all heard about, the spirochetes getting in there, that this would be an amazing therapy for a lot of people.
Honestly, the people I've done, at least half of them that I still talk to, their symptoms are not there anymore. I mean, I've had people that had Lyme's that became therapists, biomagnetic therapists, because they felt so much better.
That's wonderful. That's so great. Well, I
Yeah.
want to tell everybody, well, maybe you can tell people and where to find you
Yeah.
and how to follow you, and also about this wonderful offer that you're offering.
Yeah. So they can find me at New York Biomagnetic Therapy 369.com. And they can find me on TikTok.
Okay.
NY Biomagnetic is my TikTok.
And are you also on Instagram?
Yeah, it's New York Biomagnetic Therapy 369.
Tell me briefly how you do work with virtual clients.
Right. So long distance therapy. Um, it's like, how do I do that? They send me a picture, their information, their name, date of birth, and their location. And I connect with them and I do the therapy as if they were here. It's an energetic type of therapy, but how does that work? Well, it works like, how does Wi-Fi work? Right? How does the internet work? We don't really see it, but energy is everywhere. And this is how it works. I link with the person and it's just like if they were here. And I've done over 500 therapies, virtual therapies, and they worked as if the person was here.
Wonderful. I,
Yeah.
I love that. Well, wonderful thing talking to you and enlightening us a little bit more about biomagnetic pairing
Yes.
therapy. All right.
For
And we'll,
having-
of course. Thank you. And we'll talk soon.
Yeah, absolutely.
For our Lyme Time listeners, Katarina is offering a 20% discount if you book an appointment with her for long distance or in-person therapy. That offer ends March 29th, 2024. All you have to do is go to nybiomagnetictherapy369.com and enter the discount code FIGHTLYME20.